Bismillahirrahmanirrahim. Assalamu alaikum. Dear students, today we are going to discuss the new topic. Today we will start WBC. First of all, you must know what is the main function of WBC and what is the significance of these cells. As far as the significance of these cells is concerned, our bodies are exposed to bacteria, viruses, fungi, and parasites which occur normally in skin, mouth, and all over. These infectious agents are capable of causing diseases. We can also get infection from other sources. So our body have developed a special system to deal with these infectious agents. And for that, in our blood, a special type of the cells that are the white blood cells and the other name is leukocytes. They are present, which are going to defend our body against these infectious and toxic agents. Other tissue cells derived from leukocytes, they are also helpful as far as the body immunity function is concerned. These cells work together through two main mechanisms. Either they engulf the invading harmful agent or they form antibodies so that they fight against these invading agents. In the end of the second mechanism, again they kill and phagocytose these invading agents. We will discuss the details of all these mechanisms, but here I want to describe the main difference of these two mechanisms, that if the invading agent is smaller in size, the infectious agent is causing less harm, then it can be phagocytosed very easily. If the infection is widespread, then other mechanisms or complex mechanisms also become activated, and through that mechanisms, firstly the invading agent is killed and then phagocytosed. As far as the leukocytes they are concerned, they are the mobile units of the body protective system. As there is no fixed infectious site, infection, injury to the tissue cells can occur anywhere. So, leukocytes, either as such or their other form, mobile unit, which come out of the blood vessel, they are the main source through which you get immunity. In the bone marrow, granulocytes, monocytes, and a few lymphocytes, they are formed. And in the lymphoid tissue, mainly the lymphocytes and plasma cells, they are formed. I will tell you the more details later on. The main function is defensive. They defend our body against any harmful pathogen. Identify and destroy the cancer cells, and also function as cleanup crew to remove worn out cells like RBC and tissue debris like cells damaged by trauma and disease. Regarding classification of leukocytes, the most important thing which I want to tell you that this type of classification is not written as such in guidance. Again, you should concentrate to this lecture and also copy this classification. In different ways, we can classify the WBC. They are of different types. Their nucleus size, the lobes of the nuclei, they are different. Some of them contains granules inside, some not. So, it is not a fixed classification. We can classify WBC either on the basis of granularity or any other way also. So you must know that they can be classified in different ways. The first way through which we can classify them into two main classes on the basis of granularity. That is, in the cytoplasm of these cells, the granules either present or not. In some of the types of the WBC, granules they are present, in others it is not present. So, granulocytes having granules, they are neutrophils, eosinophils and basophils, while the cells which have no granules, they can be called as agranulocyte or non-granulocytes. The examples are monocytes and lymphocytes. The second way, the shape of their nucleus, the segmentation of their nucleus. Again, we have two categories, polymorphonuclear cells and mononuclear cells having single nucleus. So this first category have neutrophils, basophil and eosinophil, and mononuclear cell consist of monocytes and lymphocytes. The third way through which you can classify the WBC on the basis of their function. Some cells they are able to phagocytose the invading agent, while some they are very much specific for immune function. Phagocytes includes neutrophils, eosinophils, basophil and monocytes, while the immunocytes are the lymphocytes. So, through this classification, you can recognize that we can have different types of the WBC. And they can be classified in different ways. As far as the genesis of WBC is concerned, there is early differentiation of the pluripotent hematopoietic stem cell into different types of the committed stem cells that take place. Initially, we have two major linkages of WBC that are myelocytic and lymphocytic. Through this picture, you can easily see how the myelocytes they are changed to final these WBC and how the lymphocytes that is changed to finally this type of the WBC. Now I named one by one. That the number one is the myeloblast, number two is the promyelocyte, then we have number three megakaryocyte, neutrophil, myelocyte, young neutrophil, metamyelocyte. Number 6 is the band neutrophil metamyelocyte. Number 7 is polymorphonuclear neutrophil. Then we have eosinophil and eosinometamyelocyte. Then we have on number 10 polymorphonuclear eosinophil, then basophil, and on the 12th we have polymorphonuclear basophil. The number 13 to 16, these are showing the stages of monocyte formation, so that finally we have this monocyte. I write all these stages and type of the cells, how they are changed to other form one by one, that is written here. Through this table, I want to show the percentage of different types of the WBC in the blood. The most abundant is the neutrophil, which are 62%. Then we have the eosinophil, 2.3%, and monocytes, that is 5.3, while the lymphocytes on the second number regarding WBC, they are 30%. Basophils, they are very less as compared to the others. They are present 0.4%. Through this animation, I am going to show you how the lymphocyte development take place. And on the left side, I am showing the lymphocyte, and on the right side, I am showing the changes which occur during its development. Same for the basophil. On the left side, you can see the mature basophil, while on the right side, through the animation, I want to show the different stages of development of the basophil. For the development of all these cells, the granulocytes and monocytes, they are formed only in the bone marrow, while the lymphocytes and plasma cells, they are derived from common precursor cells in bone marrow and also mature mainly in the various lymphoid tissues. The lymphoid tissues of our body, mainly they are spleen, thymus, tonsil, and lymphoid tissue other than that is the pile patches in the gut wall also. WBC are formed and stored in bone marrow, enter circulation when needed by various factors which cause them to be released. And which type of the factors? It may be the infectious agent which invade the tissue, so that WBC, some of them already present nearby the infected site, they invade, they attack the infectious agent, and some they are mobile and some they are present inside the blood vessel and only come to the infectious site when needed. So depending upon the type of the type of the WBC, depending upon the type and extent of the infection and the injury to the tissue, all mechanism take place. It is not fixed. For that purpose, we will discuss how they are going to attack the infectious site. That will be studied in next lecture in much more detail. The lymphocytes, They are mostly stored in various lymphoid tissues, as I have told you, and megakaryocytes. These megakaryocytes fragment, they are present in the bone marrow, and then there are small fragments which are actually the platelets. They pass into the blood and they are very, very important for blood stoppage or blood clotting. Lifespan of WBC have different phases and different duration. For granulocytes, 4 to 8 hours in the blood and 4 to 5 days in the tissues. For monocytes, 10 to 20 hours in the blood. They move into tissues and become macrophages which can live for months. At this stage, you may be confused between the terminology what is monocyte and what is macrophages. What are the differences? But don't worry, in the following lectures I will tell you the details of all these. In the present lecture, I am just giving an introduction to WBC. With the following lectures, I will discuss much more details of all these cells, their function, and also the details of the infective process, how they are going to attack to reach the infective site, and also how the other type of the immunity, including the antigen antibody reaction, how that take place. But here just you must appreciate the introduction of WBC. Then coming to the lymphocyte lifespan, that is weeks or months moving from circulation to the tissues and back again. And for platelets, they are replaced about every 10 days. So with this slight introduction to the WBC, today's lecture is completely. Stay with me for the following details of the WBC functions. Okay, thank you and Allah Hafiz.